We're ready to roll.
Ready to
So
roll.
I hope we're on. Good afternoon. We appreciate the opportunity to share highlights of 3 collaborative efforts in which Auburn is engaged to address health disparities in Alabama. So Tim Moore and I are both Associate Deans for Research at Auburn University. I'm in the College of Human Sciences, and Tim is in the Harrison School of Pharmacy. We work with the Vice President for Research and Economic Development, along with a network of Associate Deans for Research in our schools and colleges to move initiatives forward. So now I'm going to share my screen so I can show you some of these initiatives. So I am going to check with Tim to find out if you can see my first slide.
I can see it, and I believe there's a message from Tony that those who are watching, if they double click on that PowerPoint screen, it'll enlarge their view, so they'll be able to see it a little better as well.
Thank you very much. Okay, so we have these 3 collaborative efforts that we'll be sharing. One is the Auburn University Health Disparities Research Initiative. The second one is the Auburn University Tuskegee University Health Disparities Collaborative Partnership. And the third one is the Auburn University, University of Alabama at Birmingham Telehealth Network. Before I describe these 3 collaborations, I would like to take just a moment to note why addressing health disparities matters. Health disparities are the unequal distribution of incidence, prevalence, mortality, and burden of disease or adverse health conditions that arise from the social conditions in which people are born, grow, live, work, and age. According to Healthy People 2020, health disparities reflect a particular type of health difference that is closely linked with social, economic, and/or environmental disadvantage. They are health inequities in the form of systematic group differences in health indicators or health outcomes that are the result of past or present social injustice. Thus, health disparities deserve particular attention, not only because they are avoidable and preventable, but because they are unfair and unjust. The implication of health disparities have become more apparent than ever during the current pandemic. We also see heightened attention to racial injustice, growing economic pressures, disruptions to our school and work activities, and detrimental effects on physical, mental, and social well-being. Disparities are found in many chronic health conditions and affect quality of life and mortality. Alabama has both the need and the capacity to make an impact on reducing health disparities and promoting health equity. And Auburn is engaging in multiple collaborative efforts to move the needle. So this first collaboration is the Auburn University Health Disparities Research Initiative, or HDRI for short. And this initiative engages faculty and students across many different disciplines from our schools and colleges. And the disciplines include nursing, pharmacy, kinesiology, human development and family science, nutrition science, consumer and design science, engineering, economics, and more. These researchers are engaging in basic and applied interdisciplinary research, and they also provide mentoring and classes for students who are interested in addressing health disparities and promoting health equity. The students have an opportunity to take an interdisciplinary certificate in health equity science, and this is an option for both graduate students and undergraduate students. The HDRI faculty and students have group meetings on a bi-monthly basis, and they also are connecting with communities, and they are engaging in multiple research projects together. The HDRI researchers have funding from NIH. They are particularly getting their funding from the National Heart, Blood, and Lung Institute, the National Institute of Child Health and Human Development, and the National Institute on Minority Health and Health Disparities. They also have funding from various state agencies and national foundations. The HDRI has a website, and if you see the pictures of the researchers underneath is a link to the website. And there is a newsletter that's distributed 3 times a year. And this newsletter includes information about recent publications, available funding, trainings, key events. And recently, at the end of July 2020, the HDRI held a virtual symposium that was addressing stress, discrimination, and health disparities. And they covered very diverse research topics. And you can see some of the presenters pictured here in the slide. And to give you a flavor of their different presentations, I'll share some of the topics. Telomere length, childhood obesity and racial disparities, medication access among medically underserved populations, hypertension, vascular health, and racial disparities, school-based education programs in rural Alabama addressing health disparities, Parkinson's disease and racial disparities, sleep quality and quantity and child development, racial and socioeconomic disparities, child abuse and neglect prevention in Alabama, addressing institutional oppression, and interventions promoting healthy food choices among low socioeconomic status families. So you can tell that they are doing many different things to address health disparities in the state. Some of the needs that our HDRI collaborators have are to continue to widen their pool of research collaborators. They also would like to increase their community partnerships, and they'd like to grow and diversify their funding portfolios. So that's the HDRI. The second collaborative effort that Auburn is engaging in is a partnership with Tuskegee University. Both Auburn University and Tuskegee University are engaged in extensive efforts to address health disparities. And given the calls for racial justice and the critical need to address racial health disparities, Auburn and Tuskegee faculty and administrators are discussing ways that we can do this collaboratively. We have been discussing opportunities for enhancing and adding academic programs that will permit Auburn and Tuskegee students to participate in programs that cut across our universities. We also are looking at ways to build on each institution's strengths to advance outreach and research programs. One interesting technology we have been discussing is a medical booth. This is the OnMed station, and this could be used to extend healthcare access in rural and underserved communities. We are progressing toward pilot testing OnMed stations in several Alabama communities. And we had a team of 3 people fly to Tampa, and this is where OnMed is based. And this happened at the end of July, so that they could see the station and its operation firsthand. And my colleague, Tim Moore, was one of the 3 on the team from Auburn and Tuskegee who visited the station. And so he is now going to share information about OnMed and why we see this as a very promising technology. So let me get out of this so Tim can now share his screen with you.
Thanks, Jennifer. Welcome, everybody. I'm glad you're taking some time with us this afternoon to learn a little more about our activities in this area. And as Jennifer mentioned, one of the exciting opportunities we've come across involves some technology that seems very, very right for the type of efforts that we're trying to make to help with health disparities, addressing those, particularly in the area of increasing or making better qualitative access for healthcare for all Alabamians across socioeconomic, racial, ethnic categories. The OnMed is a company that basically entered into the telemedicine market several years ago, and they would tell you, as they've told us, the time was right, in particularly taking advantage of some of the things that have happened, particularly during this pandemic, where there has been a shift toward a lot of primary care and to telehealth, telemedicine type of operations. And when we were looking at this as a tool for us to help with our outreach and research and education mission in this area of health disparities, we thought, hey, this is something that we'd like to get to know a little bit more about. I'm going to show you a video of, and it's really kind of their marketing video of what their product is. This is not really meant to be a infomercial for their company, although it kind of will be because we are talking about their product. But it really is to illustrate, we think, a very great tool that could be utilized in partnership with universities and other mission-centric people who are in health disparities to partner with and probably advance some of their missions. So I'll show you this video first, give you an idea of kind of what the tool and technology looks like, and then I'll take you through just as best I can a patient interaction or experience that they would have if they utilize the OnMed station for access to healthcare. So let me begin by sharing my screen. And I believe that is being, can you see that, Jennifer? Great.
Yes, I can.
All right, let me make sure I've got the appropriate volume controls here before we start. And I'll go ahead and start it. This is, like I said, it's about 3:20 or something like that. So can you hear, Jennifer?
I can.
And again, if you want to double click on that.
In the future, anyone, anywhere can see a doctor at any time. In a germ-free environment, surrounded by high-tech diagnostics that are remotely controlled by the clinician. Let's go one step further. Imagine receiving your prescription instantaneously, right on the spot.
If you were to call your doctor right now and say, I need to come down to your office, I need to be there in 15 minutes, what are the chances of them saying, come on down, we're ready for you? It just doesn't work that way. It does with OnMed.
These forward-thinking ideas gave birth to the OnMed station and its patented designs. An instant medical solution where and when people need it most.
The issue is, I'm sick now, where do I go? They can be in and out in 12 to 15 minutes with their medication on their way home.
Saving time and money for large employers and governmental agencies. No lost hours, no lost productivity. Ideal for rural areas, giving immediate and quality access to healthcare. OnMed has also teamed up with universities and major airports, providing around-the-clock access.
Can you imagine if you're traveling to California and you roll through Tampa Airport and here's this Z-Pack I need to get, and you're able to get that medication before you get on your flight. You fly 5 hours to California, you're already on your way to recovery.
It's the ultimate solution for anyone on the go.
I think we have untapped potential.
You could see this in airports, you could see it in large employers like Amazon or FedEx or the post office. There are so many different places that would benefit from having an OnMed station.
Space age in design, intuitive in function. Nurses, doctors, and pharmacists remotely examine, diagnose, treat, and even dispense medication through the OnMed station.
We are going to be bringing new jobs that didn't exist before. So we're very excited because we're going to make a large impact in the economy.
We brought the best minds, the best technology together to create the OnMed station.
A perfect blend of medicine and technology to deliver healthcare access like never before. Switchable glass, magnetic locks, sound dampening technology, and directional audio provide the ultimate in privacy. Antimicrobial surfaces, rapid air filtration, and UV sanitation provide unparalleled surface and air safety. The cost of the OnMed station? Typically less than even a walk-in clinic and accepted by most insurance, including Medicare. A new kind of pharmacy, a different kind of doctor's office. Finally, a smarter, faster, simply better approach to healthcare.
I remember the first pager. I remember the first cell phone. Now we have the first OnMed station. It really is that big.
Okay, so again, like I said, that was an overview, and again, it's a marketing material for the OnMed company. And again, this was put out before, or at the same time, they were starting to actually implement some of these units in different communities. And we have since had the chance to talk with their company and get some feedback on how well some of these units have been used when they've gone into different areas. And one of the things, hopefully you picked up on during that overview presentation, it's certainly what intrigued our group, was rural access. And again, that was one of the main kind of high level initiative ideas between our two universities, was recognizing that there is a tremendous problem with access to healthcare in our rural communities across Alabama. Spanning southwest Alabama, some parts of southeast Alabama, even up into northwest, northeast Alabama. So there's a great deal of opportunity to think about how we can better serve those people in the state in terms of providing health care. So, and again, as Jennifer mentioned, both us and Tuskegee, we're land-grant universities within the state, so our mission is outreach. That's very high on our list. And whenever we can combine forces to try and approach a topic like this together, that's what we wanted to do. As she mentioned, myself and a couple of others, they kind of elected us to be the tip of the spear to go down and actually stick our toes inside of one of these booths. Of course, I'm a medical background, and my colleagues, one of our colleagues was a lawyer, which was always good to have, so she can think about some of the legal things and ramifications of patient care. And then we had a really good NIH-funded researcher who was also with us. So we were very able to look at this tool or technology from dimensions for which we all wanted to make sure it was something that we thought might be useful for our mission, but also to partner with. And everything was very positive. I'll go ahead and cut to the chase. We had a very positive experience and engagement with the company. And some of the things that really took to heart were, how is it going to be for a person who would engage at this type of level, seeking a telehealth interaction, particularly if we're talking about increasing access to people who haven't necessarily had a lot of primary care, who don't go see doctors anyway, who don't have that type of either ability or sometimes willingness to do that. But the main thing is this something that would even meet the needs of what would be a good patient encounter? And I think the answer is yes. I think we all decided on that. One thing I would point out about this type of interaction is that it's patient-driven. It's patient-centric. It's not an appointment-based thing. It's not that type of thing. The person walks up to an available station that's securely located, by the way, inside another building. This is not like a phone booth sitting out in the parking lot or something like that. And there are some requirements for additional infrastructure around the unit itself. We won't go into all those details now, but those are questions and things that we did explore and evaluate for safety and other reasons. But if a patient decides that they want to seek care, then they can walk up and if it's available, they open the door and they push a button and their interaction begins. So that means there has to be a system that's in place that's ready to go. And that's where we have a lot of excitement about that, and we can talk a little bit more about that in a few minutes. But the rest of the interaction really is patient-driven, so that as soon as they're basically pressing the button, that they want to have somebody that's going to become visible to them in that virtual space in a minute. Whatever that intake person may be, it's usually a nurse assistant or someone along those lines, somebody that's going to begin taking the initial history and physical, chief complaint, and those types of things for why that patient walked into that booth at that moment. A little bit about the booth itself. We wanted to make sure that, looking at it on video is one thing, but being inside of it's another. It's a little smaller probably than what you consider a typical primary care patient room. That's because it doesn't have a bed in there, that some people are used to, in terms of doctors' offices. But it's very well organized and efficient. And what is in there is very ergonomically sound. For example, we recognize that if we have larger patients that may seek care from here, it's going to be very comfortable for them and a caregiver. It's handicap accessible, so anyone who may be wheelchair bound can easily get into the booth. And as you saw probably on the video, locking doors, the glass changes, so it ensures privacy of any patient visit that goes on inside the telemed station. On the floor, it's got scales that are high quality, state-of-the-art type instrumentation, so you can get basic physical exam parameters, basic statistics. There's blood pressure cuffs, machines in there. There are auscultation devices the patient can access. They're guided on how to use that when it comes time for that exam to occur. And when it does become time for that exam to occur is after that initial intake of the patient, who they are, why they're there, and then there is a handoff electronically to either a practitioner, who could be a physician, a nurse, practitioner, or physician's assistant, or someone who's going to then conduct, basically the full medical exam. And from just the technology standpoint, it is quite a better experience than a telemedicine or telehealth intervention that occurs by phone. I can tell you that. So temperature is measured. It's top of the line thermoscan technology. I mentioned the auscultation equipment, so you can do heart sounds, breath sounds. It is patient dependent, but the instructors, the care providers will be guiding the patient on how to use that. 4D high definition camera available for inspection of head exam, ear, nose, and throat exam. All those things can be accomplished in this visit. And then as you progress towards having a next step or an action step for what the patient needs to have, these units are equipped basically with a dispensary pharmacy. And this makes the visit even more convenient for a patient if they need medications that can be housed in a unit like this. Of course, you're not going to find narcotics there or those types of things, but you can find medications, and it's capable of dispensing medications that the patient could use immediately, depending on the diagnosis, of course. And in those cases, there could be another handoff. If there has to be further discussion about whatever the patient is there for, it's someone who's operating and interacting with the patient at a location, obviously somewhere else. They can just press a couple of buttons and bring in another care provider. For example, if a medication needs to be dispensed in Alabama, the pharmacist is responsible for that, and the pharmacist also needs to counsel the patient on the proper use of that medication. So they would basically tap in and bring in a pharmacist who would be ready and on standby to talk about that medication that they're going to get with that patient. And then, the patient can leave and hopefully, if everything was accomplished in that one visit, which could have been a minor need to just maintenance of a chronic condition, I will say it's not an emergency room. This is not a place where people should seek care for emergency situations that may require higher order care. But that's also part of the care system, is that if someone is there and it's determined that they need a higher level of care, then basically EMS can be activated immediately. And so that's also something that that's kind of built into the process. The last thing I'll say real quick about it is just the view screen. You saw a little bit of it in the video. It's very, again, I use the word ergonomic for the patient's benefit, comfort. It's clear. You can see who's talking to you. Before the patient has that engagement with the provider, when that handoff is occurring, there is introductory material that's given to the patient about who they're about to see, because they don't have a relationship with that person. But that relationship is fostered by giving some information to that person about who it is they're about to see. So those are kind of the highlights of kind of the firsthand experience of looking at the tool, and some of the relationships with us between the universities and the company in this idea of trying to improve access leads a wide range of possibilities for us to think about all of our areas, not only outreach in terms of healthcare component, but research and education. For example, just in education, I mean, we have schools within Auburn University and Tuskegee that are professional health schools, and therefore OnMed type stations or telemedicine stations like this certainly can be used as training sites, and it can be done where those student nurses, student pharmacists, and also we have an associated osteopathic school that has a relationship with Auburn University, student physicians. Could have engagement with patients that are, half a state away while they are still located where they are. I said I'd say one last thing, but I guess I apologize. I have one other last thing to say, because in the COVID era, when there's a very heightened sense of making sure we're dealing with sanitary conditions, I think you saw that at the end of the video. They've taken a great deal of caution, even prior to COVID, because this was actually in process before that, to make sure that the interaction and cleaning in between the booth, any patients that are in there is as high quality as it could be, so that the risk of contamination is very low whenever someone changes hands or re-enters the portal. And let's see, I guess that's really kind of the highlights of the OnMed station itself. And we'll probably discuss it a little bit later on as we go through the rest of our presentation. I see there are a couple of comments that are showing up in the box, and we'll try to look at those too as we're going through the rest of this. But anyway, thanks for letting me share that. And Jennifer, I'm going to turn it back over to you, and we'll keep talking about some of our other topics.
Yes, well, thanks. And every time I listen to you talk about this, I get excited, because I really see it as a way that we're going to be able to reach more people that aren't getting the help they need. And I do see a comment about feedback from the community, and we have not gotten to that phase yet where we are going to move into the piloting. We're at the very beginning, so we know that's a really good question, because we know that we're going to have to be talking with communities to determine how to orient people, how to even move forward with this before we would actually start. So that is at the top of mind before we would do anything in terms of piloting the stations. So we hope that we can continue to connect with people as we go forward. And we really do want to grow partnerships with industry, with the state, with other universities going forward, and certainly enhance the state and regional support for this effort. And ultimately, we want to make meaningful improvements in health and well-being among Alabamians. So that is, in a nutshell, what we're working on and trying to move forward with our collaboration with Tuskegee. And so now I'm going to share my screen again, and let me get this so I can tell you about one more collaboration in which we're engaged. All right. All right, Tim, am I in the right place with the Telehealth network? Do you see that?
I don't see anything quite yet. Let me.
Okay. Maybe I don't have something where I need it. Hold on just a second. Let me try one thing. All right. Nope, it should be sharing. So let me try it again. Okay.
Yeah, it's coming up now.
All right, let me go back one, because I am one slide too far. Hold on just a minute. Oops. Okay, just a minute. Gotta get where we need to be. There we are. Okay, let me try that again. All right, now do you see the telehealth?
We do. I see it.
Okay, perfect. Okay, so my technological skills could use some work, but we're here. So this is the last collaboration. This is the Auburn University, University of Alabama, Birmingham Telehealth Network. And we started meeting together. We actually formed and started meeting together about, in May 2020. And this is primarily Auburn and UAB, but we do have a few others that are joining us in the conversation. We have disciplines coming together that include medicine and psychology, nutrition science, human development and family science, nursing, pharmacy, engineering, public health, education. So it's quite a diverse group, but it's really cool when you think about it, how many different disciplines are engaging in telehealth efforts. The meeting started because we had an increasing awareness that we needed to strengthen telehealth because of what we were seeing happening with the pandemic. And it also happened because we realized that we have to extend access and preventative health support to underserved groups, and that telehealth is the way of the future in helping to do that. Our initial meetings involved getting to know each other and our expertise. And then we continued also to add to our membership. We have over 40 people that are part of this network. And we've created a telehealth catalog, and this has information on the different members and what they do. It also is a way that we share funding opportunities and other news and information. Our group is really interested in the broader issues around telehealth. So we're interested in policy impact on telehealth, telehealth payment models, modes of telehealth delivery, access to broadband and other infrastructure issues, resources and funding to support telehealth outreach and research, and very importantly, community engagement and collaboration. This past June, we had a leader of an engineering group at Auburn meet with us to talk about their efforts to enhance rural infrastructure and resilience, where telehealth is part of that. Earlier this month, we met with members of the Delta Leadership Institute, and they are working on a project to enhance and expand broadband in the Black Belt. And so they're focusing on Alabama and Mississippi. And then next month, we're going to meet with a person from the Southeastern Telehealth Resource Center to talk about the types of supports that are provided from them. And then sometime in the next few months, we will meet with the Southern Commonweal and other experts in community engagement to talk with us about those topics. And so we are really interested as a network to connect with other groups that can help us enhance what we're doing and extend our reach and our ideas. In addition to the network meeting monthly, we are starting to form some working groups that are interested in specific areas within telehealth, and they started meeting last month. So we have an obesity and diabetes telehealth working group, and we have a mental health telehealth working group. And the goals of these working groups is that we're hoping that they can support their current efforts that they are engaged in outreach and research using telehealth to address either obesity and diabetes or mental health or some other area if we have more subgroups form. But also over time, as they get to know each other, there would be opportunities to form new projects that they could work on together going forward. So collectively, we see a lot of enthusiasm and excitement in this network. And what we would like to do going forward is greater team building. We would like to find more partners that have complementary expertise. We obviously want to obtain funding for the work that's going on, and we want to build our capacity to engage with communities effectively. So that is the Auburn UAB Telehealth Network collaboration. And so here is contact information for me and Tim, and we would love to hear from anyone that would like to share ideas with us, or if you have questions that you would like us to address. We really see these collaborative efforts to address health disparities as bringing diverse researchers together, using technology in novel ways to help extend access to care and especially to reach the most underserved and high need communities. And we also see it as opportunities to train our students across our universities in ways that they can be engaged in addressing health disparities and promoting health equity. And so it really does enhance our ability to make a difference in the state of Alabama, in the southern region. And when you think about what we're trying to do, it not only is good because it's going to help reduce healthcare costs, but it also will support a stronger workforce. It will support more resilient families. It will help to connect people to services and supports they need and enhance public safety and improve quality of life, among many other things. So we're very excited about these efforts, and we hope to engage with some of you that are here today beyond this conference. And we have about maybe 7 or so minutes. Let me stop sharing this screen so we can see everybody again. There we are. And so with the little bit of time we have left, we thought we might, Tim and I, ask each other a few questions. And so a really big question, and this may be all we have time for, but I think it's a good one that I'm going to ask you, Tim, is as we think about OnMed, and we think about some of the first opportunities that we might have with outreach and research that builds on areas where faculty, in the school, the Harrison School of Pharmacy and others that with whom they're collaborating, what do you see as some of those first opportunities, and what are some challenges of doing that from where you sit?
Yeah, thanks. And it's several people that are engaged, from the Auburn and Tuskegee side of this part of this collaboration that are asking these questions. And we have identified several things to think about, I don't know that there are barriers. I hate to say barriers, but there are some obstacles or challenges, I guess, is what I would say. And in general, and one of those really would be working with communities that haven't had access to healthcare and trying to gain their trust that this is a viable opportunity, a viable, meaningful way for them to engage in the healthcare system. And I think we all have very strong beliefs and certainly thoughts about wanting to make sure we're very respectful of the community-based infrastructure and how we engage with anybody in these types of outreach efforts. We already mentioned that outreach is a primary way that we see being able to implement OnMed, but those of us that are in the room that are also researchers also have those questions too. And we can see how there can be a lot of utility in having this as a tool in the community to ask research questions. For example, implementation science questions, questions like you've already raised earlier in your talk about health disparities, very specific questions regarding that. So there's a lot of opportunity to ask and answer questions about what we can do better, not only just for quality improvement of healthcare access, but research questions really related to the treatment of diseases. For example, how are we managing our type 2 diabetic population and obesity population across the state? And giving us an opportunity to answer some of those questions. Pharmacy in particular, since you mentioned that, we've had folks that have been working in this area in outreach and research with some telehealth space. We have pharmacists and students that have projects where they engage with, in particular, veterans and vet associations to follow up with them in a teleconference type interaction to ask how they're doing, how they're managing their blood pressure and treating folks, and talking about medical therapy management. So there are a lot of people that already have some irons in the fire, so to speak, that would see a great opportunity to have a tool like this at their disposal. So what about yourself? What about at the College of Human Sciences? I know you have a very diverse group of people that fall under that umbrella, and I know there's some things probably already going on. Is there some thoughts related to what's going on in your college regarding health disparities research?
Absolutely. And before I say that, I just noticed somebody asking about privacy, how is that guaranteed? And there are steps for that. So if you want to email us after this, we can give you more information, because yes, that definitely is part of how the station operates, making sure that there is, HIPAA is being followed and privacy is guaranteed for the people using it. But you mentioned trust in communities, and so that really connects well with the human sciences. And a lot of people don't know what we do. They say, what's a human scientist? What is that? Well, we are actually in communities a lot, because we're dealing with the day-to-day lives of people at many different levels. And so we really do have a lot that we could bring to the trust building. But we're focused on the healthy development of children, families and caregiving, nutrition and health and wellness. We have people designing spaces that promote health, clothing that can be used to support health, and then even consumers engaging with technology. So things like using OnMed would be right up the alley of some of our scholars that are doing applied work in communities, and how to engage them and help them feel comfortable with novel technology. And so, with our family scientists, they focus on the day-to-day living of people. And when you think about health, who is it that is usually the first to recognize when somebody needs health care? It's often a family member. And then who is it that's also responsible when they have to go to get the care? It's often family members that are engaging with that and taking them to get the care, and then also are responsible for assisting with recuperation and health management after someone has had a treatment. So the family scientists really understand some of those dynamics and processes and can talk with people about that. Our folks doing nutrition, they really have a lot of knowledge about how diet is related to disease prevention and health promotion. So they're very essential and have a lot of work that they're doing in communities to talk about that. We have design scholars who have innovative thinking about the spaces people use and the clothes they wear, which can really make a difference in helping with supporting health and mobility and all kinds of things. And as I mentioned, we have some that are doing consumer research, and they are actually looking at how we can help elderly, for example, use computers and technology that helps them manage medications. They're actually collaborating with people in pharmacy to help with a project that is addressing e-pharmacy questions. So many different things within our discipline that connect so well with helping reach people who need help with all kinds of healthcare and health issues. And so thank you for that question. And it looks like we only have about 1 minute. So we just really appreciate the opportunity to share the collaborations that we are having with different partners, and we both welcome follow-up. We hope you will email us. We hope you have ideas you'd like to share, and certainly questions that we can address as well. Tim, if there's anything you want to say before we sign off.
No, I just thanks for the chance to work with you, Jennifer. I've had a pleasure as we've been discussing these opportunities and sharing them with our colleagues who've joined us today. We have noticed people who have put things in the chat box. This has been recorded, so I think we'll be able to capture all of those things. I've written down some while I've had the chance. But please, if like Dr. Kirkland, Jennifer said, reach out to either herself or myself initially, and then if we need to redirect you somewhere, we can do that.
We will certainly do that. So thank you, and I think it's now off to the next social networking. So thank you very much. Bye.